Welcome back, kids and coaches. Today we are getting into chapter 17, which is going to be the thigh, hip, groin, and pelvis. This one should be pretty straightforward here. We'll see how this goes though. So let's go ahead and break this down from a fundamental standpoint. So first things first, with the hip and pelvis, you have primarily two joints and you've got really four bones that you're dealing with. Now, your spine and your sacrum, your coccyx, those are all kind of in there, but really don't act a whole lot with it. The SI or sacroiliac joint, that is going to be the joint that forms between your sacrum here and your ilium. So that is right there and right there. The main bones you have, your ilium, ischium, and pubis, all form your pelvis. So when you talk about your pelvis, you have these three bones that form together. The ilium is what you would consider kind of your hip. So what you feel on the side of your waist, that is really your ilium. Your ischium is what you sit on. So if you reach underneath your butt and sit on your hand, what you feel, the bone you feel there, is your ischium. And then your pubis comes anteriorly, so this runs in front. Kind of looks like a frowny face now, but your pubis is going to be anterior, so you would feel that if you were just kind of in your groin area in front of there, that's where your pubis is. All three of those are fused together to form your pelvis. Your femur, like we talked about with the knee, is your thigh bone. Your femur connects with the pelvis to give you your acetabular femoral joint or your hip joint proper. Your SI or sacroiliac joint, which is right here, forms between your sacrum, which is this guy right there, which is part of your spine, and your ilium, which is here. This doesn't have a whole lot of movement, so we're not really going to focus too much on that. We'll touch a little bit more on this when we get back into the spine though. Now your anatomy, we've been talking about anatomy, your soft tissues here. Well, we've already talked about hamstrings and quads, and we talked about them in relation to the knee. So you're talking about the bottom of these. Now we're talking about them in relation to the hip, which means that we're talking about the top of them. The primary responsibility of your quads and your hamstrings, your thighs, the primary responsibility is to move your knee. The front of your thigh or your quads extend your knee or straighten your leg. Your hamstrings or the back of your thigh flexes your knee or it bends your leg. Your muscles in your leg move your leg in the direction they're facing. So meaning, my quads are in the front of my leg. They're going to move my hip forward. That's called hip flexion. My hamstrings are behind me. They're going to move my leg backward. That is hip extension. Your glutes or your butt, they are behind you. They are going to move your leg backward into extension. Your glutes, so glute maximus specifically, first off, glute max is the biggest muscle you have in your body. So you sit on the biggest muscle you have. The only reason your glutes are as big as they are is because we are bipedal animals. If we didn't walk on two legs, we would not have a butt like that. If you walked on four legs, you would have a flat ass. And the whole purpose of the glutes is to allow us to stand up and keep an erect posture. You wouldn't be able to walk on 2 feet without glute max. Now, glute max is your primary hip extensor, meaning it kicks your leg backwards. Your iliopsoas, which I don't have here, but that's okay. It's actually going to be You can actually see it right here. But your iliopsoas would actually be formed in here. You could see it coming down in there. But that is your primary hip flexor. If you're sitting down and you feel at your hip, right where you're sitting down, and then you just go to pick your leg up. So hopefully this gives you a little better of a picture. So got my hand right here on my, right there on the front where my torso meets my leg. So right where you would move your leg forward. If I go to just pick my knee up or pick my leg up off the ground, you will feel a major flexion happening right here. A big muscle flexes. Part of that is your quads, but if you feel deep in there, that is your iliopsoas. That is the primary hip flexor you have, meaning it's the one that brings your leg forward so you can raise your knee up. The two pieces of soft tissue you should know here really are the acetabulum and the IT band. Now the acetabulum is the entire socket you have in your pelvis. So this is what forms really the socket for your hip bone. So where the femur meets that for that ball and socket joint, that's the acetabulum. Just like in your shoulder, you have a labrum in your hip. This can be injured. It's actually a much worse injury for you to have than it would be like with your labrum, because the mechanism of action or the cause of injury isn't all that well understood. Remember the IT band, we talked about forms between your glute medius, glute maximus, and your tensor fasciae lata. It also will have a little bit of an insertion with your biceps femoris or your hamstring. Anyway, all this here, so all this is your IT band or your iliotibial band. Forms on your ilium, hence the name ilio. So the hip bone up here is where that forms. And tibial refers to your tibia or your shin bone. So it actually connects down past your knee. It is the longest tendon you have. Now, a couple tests you'll want to be aware of. Thomas test and the Ober's test. If you have tight hip flexors, the Thomas test will make sure that comes out. This here is the Thomas test. What would happen is you lay down on a mat table and you have both of your legs dangling off. So you want to go up to your knee and you want your knees dangling off. You take one leg and you pull it towards your chest. If the other leg comes up like this, that means you have tight hip flexors. This doesn't mean that you have tight hamstrings. It's a very big misconception there. It means you have tight hip flexors because they're pulling your leg up. The Ober's test is going to test for IT band tightness. For this, you go side lying. You have to kick your leg back into extension and knee flexion. And then you go from a adducted knee to a neutral knee and then up and then back into extension. If you have IT band tightness, you're going to not be able to keep your hips stable, and you'll feel pain on the lateral side of your knee. Well, I shouldn't necessarily say you'll feel pain, but you'll feel tightness on the lateral or outside part of your knee. Now, getting into the injuries here. The major thing you're going to find in the hip and pelvis is having strains to the big muscles. So quads and hamstrings. Remember, if you have a muscle strain, you have a tear in the muscle, or you have a tendon strain as well. So a strain, again, means muscle or tendon. A sprain refers to your ligament. Very common, you can pull a hamstring. If you pull a hamstring, that is a muscle strain. You still have torn that muscle. Much more common is to have a hamstring strain or a torn hamstring. The whole reason why is your hamstrings do tend to be tight, and you use them every single step you take. So every step you take during the course of the day, your hamstrings contract and relax. That means that they are getting very, very tight because you are using them thousands of times a day. Where you would strain a hamstring is typically on the start or stop of running, especially when you go into like a sprint. Usually you're not going to strain these muscles if you're just like walking or jogging. There's just not enough force there. But if you go from a starting position to sprint, that puts you at your biggest risk, and also stopping or slowing down puts you at a big risk as well. Now, fractures here, these are pretty serious. If you fracture your femur, life is not treating you well. Fractured femurs are really only caused by blunt force trauma or something like a car crash in apparently healthy adults. Now, as you get older, and if you develop, say, like severe arthritis, bone degeneration, bone breakdown, cartilage breakdown of the hip, osteoporosis, osteopenia, now you look at potentially having fractures in the femur just from a loss of bone density. If you are injuring the femur as a normal athlete or as an apparently healthy adult, you take a lot of force to do that because your femur is the densest bone you have in your body. Now, your teeth are really dense because you have to chew everything. So your teeth actually aren't considered bones. They're actually more of like a calcium and dentin type amalgamation there. But your teeth are the strongest bone-like substances you have in your body. Even if you chip a tooth, it takes a ton of force to do that. If you break your femur, so you break your leg, which is your thigh bone, you have a ton of force that has to hit that because this is the densest bone you have in your body. If you break a femur, season's over. This is a 4 to 6 month healing time. If you were maybe a spring athlete and you broke it like the first day of fall practice, maybe you can come back in time for like your tournament or postseason play, but kind of unlikely. If you need a hip replacement, this is what it looks like. What will happen is the femur here will get cut off at the neck. So just like that is actually broken. And then this here is typically made of some kind of a non-toxic metal. For all you Grey's Anatomy fans out there, one of the recent plot points they had was that Richard Weber was going crazy having Alzheimer's syndrome or Alzheimer's symptoms because he had a hip replacement that was made of cobalt, and it was actually degenerating in his hip, causing cobalt poisoning. So they don't use that anymore. That's actually a true thing, that cobalt as a hip replacement or a knee replacement isn't used anymore. So what would happen is they would drill this straight into there, screw it in, and that's your new hip. If you get a hip dislocation, this is, again, very, very traumatic. Usually this comes from a car accident. MVA means car accident. So it's not really something we're going to deal with a whole lot, but it is something to know. If you dislocate a hip, you have caused a lot of trauma to it because that hip socket is really tightly compressed. So it has a lot of support to it. If you get a hip pointer, this is one of the most common injuries you'll get to the hip. It just means you get a bone bruise or a bruise on it. Bruise is internal bleeding. It just means you've broken blood vessels just underneath the skin. If you get a hip pointer, you have been hit there. So you only get that from collision. I guess if you fell on it potentially, but someone hits you primarily. You see this a lot of times in football. You're only limited by having pain tolerance. So if you can tolerate the pain, you can play. Last thing here is nerve injuries or cartilage injuries. We've talked about hip labral tear a little bit earlier. Those are really not, again, not well understood about the mechanism. If I tear my labrum in my shoulder, primarily that's from overuse. Like if I'm a baseball player, especially like a pitcher, your labrum takes a lot of stress. But everyone walks and everyone uses their hip bone all the time, but it doesn't break down the same way that you would, even if like you're running, that you would get from a labrum tear in your shoulder. So that's really not that well understood. Alex Rodriguez had to have labral tear surgery for his hip and actually cost him almost a whole season. Piriformis syndrome, this is where you have an issue with your sciatic nerve, where your sciatic nerve gets compressed from your piriformis muscle. Your piriformis muscle is actually right behind your, well, it's right underneath your glute max. So it's really a small muscle underneath you there on your butt. And your sciatic nerve is the biggest nerve you have in your lower body. It's going to run down through your butt, down the back of your leg, and down the side of your leg. It actually goes underneath, though, the piriformis muscle. If the piriformis muscle is tight, it can compress that sciatic nerve, causing pain, numbness, tingling, even like shooting pain, especially down your leg. If you have sciatica means that you have an inflammation or you have some sort of impingement on the sciatic nerve. The overarching term for having nerve injuries or nerve issues is radiculopathy. If you have sciatica, it means that you have some sort of issue with the sciatic nerve, typically involving compression of it, meaning something is compressing on there, which causes pain, numbness, tingling, loss of function, loss of sensation, or extreme oversensation down your legs. So that is your overview there of the hip and pelvis, and I will see you all again here soon.